Well, welcome to this episode of Medical Rounds, where I will answer the questions: what is the cross-reactivity between penicillin and cephalosporin antibiotics, and, more importantly, why this can happen with certain cephalosporin antibiotics? Hi guys, I'm Dr. Busti, and welcome to This Is Why, a show dedicated to helping healthcare professionals understand the why behind the clinical decisions we all make. Because when you know the why, you can master how to provide the best care to the patients we all have the privilege to serve. This question matters because penicillin and cephalosporins make up a major portion of the drug class Beta-Lactam antibiotics that are used every day in clinical practice. That also extends from the outpatient to the inpatient environment. So regardless of where you practice, this very medical rounds question is likely to be something you will encounter today. Now, by the end of this review, you will not only know the actual risk of cross-reactivity, but you're going to also know which antibiotics carry the greatest risk in the proper context of the best available evidence. Now, given that, let's answer the first part of this question. What is the known risk of cross-reactivity? Okay, now we first must address the historical versus the evidence-based risk of cross-reactivity between patients reporting allergies to penicillin and the use of cephalosporins. Now, historically, that risk was thought to be between 5 and 10%. But the current best available cumulative evidence suggests it's actually between 1 and 2%. Now, why is there a discrepancy between those two numbers? Well, it's for three reasons. First, it is estimated that 8 to 10% of patients in the U.S. report a penicillin allergy, but less than 10% of those patients are actually truly allergic after formal testing. That means that 90% don't actually have an allergy. Second, we had a lot of cephalosporins back in that time frame that no longer exist. Now, many of those were some of the culprits. We still have a few culprits, as we're going to see here in a minute, but fewer of them. Third, and lastly, the overall quality of research today has greater internal validity and less bias compared to the past. Okay. So your first take-home point here is to know that the current risk is about 1 to 2%. However, there is a catch, right? That applies to the overall consideration of the entire drug class, which represents cephalosporins across all of their generations. There are some cephalosporin antibiotics where the risk is actually greater and has been reported to be as high as 16%. I get it. I know. You're likely saying, what? As high as 16%? Why and which ones? I mean, those are great questions. So let's address the why, and that will make sense. All right, so those of you that are listening to us on our podcast channels, I'm going to do my best to walk you through some of these images and tables and charts, but they're available for free download at thisiswhy.health, okay? That link is also provided in the description of this particular episode. Okay, so what you see here in this particular diagram is on the left side of the screen, we have the basic core structure of penicillin. On the right side of the screen, we have the basic core structure of cephalosporins. You can see that both of them have the beta-lactam ring as identified in the shaded green area. That is that square box in the middle, that represents the beta-lactam ring. And interestingly, the beta-lactam ring is not the main reason for the cross-reactivity. Okay? It actually is related to the R1 and R2 side chains that you see on these core structures, and they're highlighted in that shaded blue as well as the shaded red. Okay? So you can see on the left side for penicillins that the R1 side chain is at position 6. And the position 6 is talking about the sixth bond in the order of the bonds as it relates to the beta-lactam and the ring structure to the right. Whereas on cephalosporins, the R1 side chain is at the 7th position Again, because there's more bonds and a different ring structure in the cephalosporin antibiotics, okay? Now, where the cross-reactivity primarily occurs is in the similarities of those R1 side chains between penicillin and the cephalosporin cross-reactivity. So what that means is the more they look alike structurally, the more likely there is a cross-reactivity. That becomes very important here in just a second, so stay with me, okay? It does make sense. When you look at the R2 side chain over here with the cephalosporins, that has more to do with the cross-reactivity between cephalosporins. Okay, now I summarized that down here at the bottom for you, so that the cross-reactivity is between the R1 side chains between penicillin and cephalosporins. The more alike they are, the greater the risk. And the cross-reactivity within cephalosporins is more related to the similarities of the R1 side chain and the R2 side chain. Okay, so let's pause there for a moment and recognize the following. You know, we use the word penicillin, and while penicillin is still used in everyday clinical practice, amoxicillin from the aminopenicillins is actually far more common. This is actually where the cross-reactivity can be higher than that 1 to 2%. Okay, now I need you to follow me again here. The why is going to make sense here in just a second. So what's important to see in this particular diagram is that we have the structure of penicillin, and I chose to give you the structure of penicillin G versus penicillin V, which really only differ at this oxygen here in the R1 side chain. And then over on the right side, I give you the two main core aminopenicillins, amoxicillin and ampicillin, okay? What makes them aminopenicillins? Well, it's this amino group here that you see highlighted and shaded in green. That's NH2. That is an amino group. When it's bound to a structure, so the R-NH2, that's an amine group, but it's an amino group. So you get aminopenicillins. That's where it gets its name from. That becomes very important when we start to now look at the cross-reactivity to the cephalosporins. The only difference we also can see here from amoxicillin and ampicillin is really this hydroxyl group. All of these side chains and functional groups that are on there influence the spectrum of coverage that these antibiotics can have. It also influences sometimes its pharmacokinetics profile, okay? So that's why some of these things begin to matter. All right, so now that you see that aminopenicillins, amoxicillin and ampicillin, have the small difference than regular penicillin, let's close the loop on this question and see why that matters. Now you remember those NH2 or amino groups that we talked about on aminopenicillins? Well, they're also on cephalosporins, and we have aminocephalosporins. And that is where the greater cross-reactivity come in. Let's now look at those and see the full why. Okay, so in this particular diagram here, an image that I'm providing you with the chemical structures of the aminopenicillins on the left. So on the top you see amoxicillin, and then on the bottom, okay, separated by that line, is ampicillin. Those are your aminopenicillins. You see the amino group attached in that R1 side chain. And if you go looking over to the right, you now see the equivalent, basically, aminocephalosporins. When I say equivalent, I'm talking about the R1 side chains. Because remember, that's the cross-reactivity is the greatest, meaning these are the cephalosporins that you would see higher rates of cross-reactivity and would want to avoid. So you see that cefadroxil, which is a first-generation cephalosporin, and cefprozil, a second-generation cephalosporin, have all exactly the same R1 side chain with that amino group there. They're all the same. And that's why that cross-reactivity is greater with amoxicillin. So cefadroxil and cefprozil are the ones, if you have someone with a true amoxicillin allergy, would be the ones that you'd want to avoid. When you look at ampicillin and you go across to the right, you see that cephalexin, a first-generation cephalosporin, and cefaclor is second generation cephalosporin, that you see again the same R1 side chain exists. So it's that hydroxyl group that is largely the main difference, okay? Now there's an important observation to make about this visual here that I have for you. And again, these are available for you for free at thisiswhy.health. But you don't see third, fourth, right, fifth generation cephalosporins. They're not there. They're not listed here. Now that doesn't mean that there's absolutely no cross-reactivity. It just means that there's no equivalent R1 side chain. So these are your greatest risk when it comes to that crossover activity between a penicillin and cephalosporin. Okay, let's pull all this together. Number one, right, not every patient who presents with a reported allergy to penicillin is truly allergic to penicillin. If there is doubt, get testing so that you do not sacrifice the entire class of medications as if they're all the same when they're not. Number two, the risk of cross-reactivity between penicillin and cephalosporins is, as a class, is about 1 to 2%, not that historical 5 to 10%. Number three, the risk is higher when cephalosporins share similarities or are identical in their R1 side chains to their penicillin equivalent, so penicillin or aminopenicillins. Number four, the cross-reactivity between cephalosporins has to do with shared R1 and R2 side chains, okay? And so, for example, if you look at cefadroxil and cephalexin, right, there's a lot of similarities going on there. So those may be ones that we would avoid in patient-specific scenarios. Number five, the risk is even lower with higher generation agents compared to first and second generation agents. However, the risk is low, but it's not zero. That does not mean that you should just check off the fact that someone has an allergy to penicillin and it's meaningless, but rather put it into the context of the patient, their history. What are they needing to be treated for? What is the risk and pros and cons? Consider picking a cephalosporin that has different R1 side chains from the penicillin agent of main concern. Okay guys, I hope if you found this information to be very helpful to you, that you would please consider subscribing to our channel at YouTube, okay? Also would appreciate you giving us a like and sharing this with your friends, colleagues, maybe other people that need this type of information, because the idea there is it helps us to continue to provide the content to you. Okay, if you want those images, those tables and things for studying, or you teach and you want to share that with some of the resident students and colleagues that you may work with, right? That is available at thisiswhy.health. And again, we put that link in the description of the video. Lastly, a special thanks to all of you for listening and investing in your knowledge and for what you do for the patients you serve every day. I'm Dr. Busti, and learning the why in what we do helps us to master the how so that we maximize the benefits of the care that we provide to our patients. If you want to practice applying this type of information that we just covered here today, check out the practice test question video and lecture that I did covering this core concept. All right, take care, guys.